This is Dr. O here, and welcome to Health Caring Differently, where we inspire diverse students to explore careers in healthcare. This is the launch of season 2 and a very special episode. Usually, I would tell you to tune in Tuesday at 7 p.m. every week to hear some interviews. But today is a Thursday, and it is an exception because there's an exceptional reason, and I'll come to that in a moment. But I would like you to follow us on all our social media platforms to stay in the loop and gain valuable resources and hear more about our future streams. Also, sign up for our newsletter so that you can get information on diversity pathway programs for medical school, scholarships, and research opportunities. Feel free to drop questions for us today. So this is a live stream that is, for the first time, we're doing on Instagram Live, YouTube Live, LinkedIn Live. And so if you drop your comments in the chat, of course, respectfully, then I'll make sure to ask them. Now, the reason why we're on a Thursday is because it's a special episode. Today's guest is Dr. Alika Lafontaine. He is an award-winning physician, the first Indigenous and youngest physician to have led the Canadian Medical Association in its 156-year history. That's 156 years, y'all. He was the first. And so Dr. Lafontaine is a Métis anesthesiologist with mixed Indigenous ancestry. Dr. Lafontaine has served on all sides of advocacy for the last 20 years. He co-founded and co-led the Indigenous Health Alliance, Canada's most ambitious Indigenous health project at the time, which raised $68 million for health transformation. And then in 2020, he co-founded Safe Space Networks, an anonymous platform for patients and providers to report cases of racism and harm in healthcare. Dr. Lafontaine continues to practice as an anesthesiologist in Northern Alberta, where he lives with his family. Welcome, Dr. Lafontaine.
Thanks for having me. I love the energy here.
Oh, well, I mean, I'm just really excited. I told you I've been meditating on this because it's history in the making. It's beauty for me. This is about love of community, love of society, love of humanity, and the calling of what medicine truly is. So thank you I know you have a busy schedule, so I appreciate you for coming on.
I appreciate you too. I appreciate this on a Thursday.
Right. And so, yes, it is really cool. But we've got, students from all over the country who tune in and also watch the videos after. So I think, in keeping with the Gen Z timing, I'm going to jump right into stuff, right? So we're going to just dig right in right away. Now, I ask all my guests this because it's health caring differently. We are different and we approach healthcare differently. So may I ask, and you could decide what order you want to do it in. I want to know how you are health caring differently and how you went about your journey into health caring differently.
Mm-hmm. I think the answer to that's probably the same. Those two questions is probably the same answer, to tell you the truth. So one of the things that I picked up over my life is this idea that people have to be the center of what you do, and that we all kind of have our own stories, right? So my story in childhood had a pretty big bump where I was labeled as learning disabled. And my mom and dad were brought into the principal's office along with me after the school had done several months of speech therapy without telling them. And they were sat down and they were going back and forth with administrators about what had happened. And the principal said, your son's never going to graduate high school. I just want you to know that. It's just not going to happen. And my parents had always poured a lot of energy into making sure that we appreciated school. My mom was a first generation immigrant. She came to California. She was from the island of Tonga, Pacific Islander. My dad was Métis, grew up in a place called Lestock. Well, they were always taught education was like the way that you get to where you want to go. And
Mhm.
so they instilled in us kids the idea that that was our way to make a better future for us and our family. And my parents broke that day, and I remember my mom holding me, and I've told this story a few times publicly before, but I remember my mom holding me in the car after the meeting and just kind of rocking me back and forth, just saying, "You're not broken. You're not broken." And from that day on, I had this idea in my head that there was something wrong with me, right? Like,
Can
what kind of kid is going to go through that and walk away without thinking that, right?
but can
And
I just I'm just
Mhm,
trying to mentally put myself in your parents' shoes based on what you just
mhm,
said. So your
yeah,
parents facing all types of injustices in society and their journeys and barriers and overcoming them by using education as a tool.
mhm,
Have you a child who they aspire through they poured their, you know what I mean, their love, their resources, and of course, just like any parent is dreaming of you being able to go much further than them. And then this person who is an educator, who studied to educate and empower youth, hopefully,
mhm,
tells your parents you will never pass high school. Instead of
mhm,
offering a pathway or anything like that, they just shut down that dream that your parents have
mhm.
right
Yeah,
there with you. I
and
just wanted
I
to kind of yes, go ahead.
yeah, and I think you're totally right. Like, my mom experienced a lot of racism when she came over, couldn't speak English. She told us that one of her first jobs was at J.C. Penney. She would actually stand and model the clothes, and kids from school would come by and, throw stuff at her and other things, just to cause trouble. My dad obviously experienced racism as, a Métis kid in Saskatchewan. But, you build this life, and then you wanna give that life to your kids, right? And you want them to do better than you. You want them to go further. And, um, from that moment moving forward, um, I like I said, had this idea in my head that, there was something wrong with me. And my parents poured a lot of effort into helping me overcome those learning challenges. And, I did turn a corner. It's probably another episode talking about how they did it. But I eventually had something click and, graduated high school early. I'm into like college and dreaming about being a doctor and all these other things. And I think along the way, I realized that, my own journey of feeling like there was something wrong with me, like everyone kind of goes through that to some degree.
Mhm,
Some of it's experienced because of racism, some of it's experienced because of class, other things because of the way that um, we have physical challenges that we're overcoming. There's all these different reasons why we feel like
mhm,
there's something wrong with us. And
yes.
I think that that really informs the way that I go about trying to advocate, but then also how I provide care.
Mm,
Because in the back of my mind, I always sit there and think to myself, when I'm giving someone a diagnosis or when I'm giving people options for, different types of routes they could go for their care,
mhm,
am I like that principal sitting across from me who very coldly said, "This is the way it is, and that's it," or am I sitting there taking in their experience and letting them kind of steep in the moment and like walking with them through what is usually a very, very traumatic time?
right. And from what I'm gathering, also you're considering the possibilities. I mean, we're gonna talk about the work that you're doing with the Canadian Medical Association, but I think it's part of what the vibe that I'm getting from this story is looking beyond what people say are the limitations and being able to see something greater in ourselves, in each other, in community, right? And it looks like your parents were able to do that for you, and you are able to do that for your patients and for communities. Now, of course, we have a lot of students on the line, and some people might be experiencing or have been diagnosed with learning challenges. Certainly, I have folks in my family who have dyslexia and who have thrived and are thriving. But in your journey towards medical school, because that's where a lot of students are. They're either early in medical school or a lot of them are
Mhm.
thinking about medical school. Were there any challenges that you had to overcome at that phase? I mean, you had already leapt bounds over a major challenge in high school. So were you able to come in like, you know what I mean? You can't stop me now, kind of, you know what I mean, vibe? Or were there challenges along the way where you had to overcome?
Yeah, I was pretty lucky. Like most people who get to the places that we get to, there's obviously shoulders that we've stood on, right? Our parents, special teachers that have come into our lives, people that saw us as more than what we saw ourselves at the time. So I have a long list of folks that helped me to believe in myself.
Mhm,
Um, my specific learning disability was I had a very, very severe stutter. So you notice sometimes with my cadence, I purposely slow down. That's actually me suppressing my stutter, right? It's just a kind of habitual tick that I've picked up, right?
mhm,
Um, and so I think that as people are going through their own challenges and trying to find who they are as they move towards, like the most important thing is to find people who see you as more than what you are right now. You know, sometimes when we're in the midst of going through these challenges, we just see everything as negative, right? Someone
mhm,
reaches out and tries to help us, we think that they're trying to take advantage of us, or we're setting ourselves up just to be disappointed. You know, really encourage people to give people space to be there for us. You know,
mhm,
no one gets into med school alone. You know, even folks who seem like they get in alone, or those who come from privilege, like they obviously are standing on the same sorts of shoulders, but maybe having a different type of journey, right?
yes, I
And
say it
so,
takes a
yeah,
village to support a doctor to create.
100%, 100%. And so, yeah, really reach out to people. And then I think the second part is to realize that there's some things that you can overcome and leave behind, and other things that you're going to revisit over and over again. You know, like
Mm,
with my stutter, it never has disappeared. It's just something that I've learned to live with, right?
mhm,
The feelings that I have had as a kid where I felt like there was something wrong with me, those resurface from time to time, depending
mhm.
on the situation. And so there's nothing wrong with you if that happens. That's just how it is, you know. And so lean into it and just try and own it. You know, you'll be able to make it to where you want to go if you can kind of own and try and control what you can control.
Yeah. No, I love that. And that's so part of the human experience, right? As you said, we're all coming from different paths, but there are challenges that we face, some more than others. Obviously, we're speaking in a context of medicine where indigenous folks are, significantly underrepresented
Mm.
in medicine, but that is changing, right? And Black folks are underrepresented in medicine. But as you said, there are folks from our communities, beyond our communities, folks who look like us, folks who don't look like us, who have helped us on this journey. And I love your message about being open. Sometimes I feel like it's a trauma response where,
Mhm.
somebody will reach out, but people are so scared because of, for valid reasons, because of past experiences or intergenerational trauma, right? Like, experiences of a parent or something that's happened to them and just like, be careful, don't trust. That certainly has happened in my life or with some of, the students that I know, but there's so much value in opening our hearts. So I love that message that you give. Um, and what I love is that it's not just a message, you walk your talk. And so I'm hoping there's going to be questions in the chat soon because we're going to go till 7:30, but I think it's time to dive into the apology, the work that you have been doing, which is just the amazing. You talk about we have stood on the shoulders of giants, but these are giant footsteps that you have
Mhm.
taken and brought community and allies with you, done in collaboration in community. So this Canadian Medical Association apology, I mean, if you Google CMA apology, this is there's no other apologies I could find. Like this is the apology to Indigenous communities, Indigenous folks for the harms that medicine has caused. And you have led the way and had the vision. But I know that it's not, we come from communities where we are not the sole person. So I'm saying you, but I know that there are so many linked in arms with you. But can you tell us about how that has come to be, how we end up here, where on September 18th, there will be a public apology to Indigenous communities?
You know, when you look back on your career, and I wonder if this is the same for you, I see certain things that just aligned, you know, and I can't explain why they worked out the way that they did, but if any piece was missing, things probably wouldn't have progressed forward the way that you hoped. right?
Mm.
With the Indigenous Health Alliance project, if the leadership of the three provincial territorial Indigenous organizations were different people, or Jane Philpott was not Minister of Health, or
Mm.
there was some other piece that was missing, I think that project would not have turned out the way that it did. And it's the same thing with the CMA apology. So I came in as the first Indigenous president of the organization in 156 years. There was an Indigenous Guiding Council that had been part of reconciliation work that had been brought together. Some Indigenous staff had been hired. The board of the CMA had already committed to reconciliation at this point. Senior leadership had committed to reconciliation. So the foundation was really built in part prior to being able to come in. And the apology actually had its roots in the members of the guiding council that were giving the CMA different ways that they could go about reconciliation.
Uh-huh.
And when I was taught about apologies when I was young, there's these periods where we get along with people and then we run into conflict. And then as a result of that conflict, we like hurt each other. Right.
Mhm.
And then we either go into a place where we repair those relationships or lose those relationships. And I think that that's the space where reconciliation lives,
Mm.
where the bad stuff has happened. And then as a result of how you walk forward, you either fix it or you fall further apart.
Mm.
And, the path to the TRC that started off, I think, in the 1970s with the Oka crisis and realization of Canadians with Elijah Harper shooting down the um, changes to the Constitution and the Charlottetown Accords, through resisting in the Manitoba legislature, and then the Royal Commission on Aboriginal Peoples that then led into, the work of survivors to really push for the settlement for residential school abuse and the eventual Truth and Reconciliation Commission. That whole path, I think, is why we even talk about reconciliation today. And I
Mm.
think it's why Canadians generally look back at our past and actually acknowledge, harm happened to Indigenous people or to scores of other demographics, including
Mhm.
Black Canadians, and, sit there and realize, we actually have to do something to try and repair this, and so the apology process has taken a few years in the CMA. It's been ups and downs, things going fast and then going slow. We're going to present the apology on September 18th. Linked to that is an action plan
Beautiful.
for what we're going to do about the apology.
Mhm.
My mom used to always tell me, "Don't say sorry unless you're going to stop what you're doing." You
Mhm.
know, and I think that that's been a failure of a lot of apologies. Folks have said sorry, and then they just keep on doing what they're doing.
Yes.
And I'm really proud that the CMA has reached a point where, it's putting one foot in front of another in like this very tense, tension filled space.
Mhm.
People are both excited and concerned about what this means for medicine, and there will be repercussions. We'll have to look at the ways that we've reacted to anti-racism, and we'll have to acknowledge a lot of the harms that have happened specifically to First Nation and Inuit and Métis people. Everything from sanatoriums where people were pulled from the north down to the south, taken thousands of kilometers away from their family. Some people were never reunited and ended up dying in hospital or in another community. Medical experimentation that happened, Indian hospitals were segregated care. There's lots and lots of examples, I think, that we've come through studying our own history over at the CMA. But, as we go through that harm, then there's the chance to repair. And that's what I'm really excited about after the apology.
Yeah, no, I mean, you know, lately when I've been reaching out to some of my Indigenous colleagues in medicine for different reasons, like different things going on, but folks are talking about, yeah, you know what I mean? We're headed out to BC. And I'm like, wow, like folks are going, you know what I mean? Like
Yeah.
this is a movement. This is powerful. This is, some folks who have experienced a lot in medicine and felt othered or a bit cynical, but there's this season of hope that you know what I mean? I'm
Mhm.
experiencing vicariously, of course. That excites me about this work. I have so in speaking about this work that you're doing, to my children who are 7 and 8 years old, but they're always curious about these things, and some of my family members. Of course, we experience or we understand these things through the lens of our own experiences of historical oppression, and I got what I noticed is I kept getting a particular question, and I don't know if it's helpful or problematic in saying like, okay, well, what are the concrete examples of where medicine has harmed Indigenous folks, right? Because to me, I didn't even think of the question. To me, it's obvious and it's ongoing. Um, so I began to name some of the examples you've given, and the malnutrition studies in Toronto at sick kids with Indigenous children. Just the harms in the residential schools and the role that medicine played. But I was like, this is not just about history. This is about examples like Ryan Sinclair, who was ignored to death in the
Mhm.
emergency department, or Joyce Echaquan, a mother. Hopefully I don't have to explain the Joyce Echaquan example, the terrible and cruel death that she experienced in healthcare. So it's historical and it's present day. But even when we name people, it's a bit problematic. This is where I'm asking you the question. I've rambled,
Yeah.
but this is the
Mhm.
question. When we name things, so in Black communities, we name like the Tuskegee experiment, right? Where Black people were mistreated. But a lot of people don't even know the Tuskegee experiment. They just know in Black communities, they just know they don't trust healthcare, like
Mhm.
intuitively, because of the racism experience. So sometimes when you name examples, it becomes so discrete or historical that it takes away from the everyday of what's going on. But sometimes it's helpful to have concrete examples so people can understand. What is your take on this? Because there's going to be lots of discussion, right? And
Mhm.
those of us in positions to try to be allies, because it's always a practice where we, do well and sometimes we fail. But is it better to talk about this in the context of discrete examples, or really to say this is happening every day, regardless if we have a name or somebody was in the newspaper? What are your thoughts?
I think that one of the things that has happened with just discussion of let's say racism, for example, right? Um, when ideas are abstract, it lets you hear about them and then you can project yourself onto them, right? You can
Mm,
sit there and say, I'm a part of that. That's something that I identify with. But when you look at actually changing things, right? Like
mhm.
getting to that action part, you actually
Yes.
have to get very concrete. And sometimes getting very concrete means that you're going to do this, but you're not going to do that. Right.
Hmm.
And
Okay.
I think that as you kind of bring people along, abstract ways of talking about stuff is really good to scale ideas, spread them around and get people kind of unified that this needs to be addressed.
Mhm.
But you need concrete examples in order to show how are you going to impact that, right? And I think that that's something that we've learned over the past 2 years with the work that was done with the action plan is that what people want is enough detail to see that change can actually happen, you know? And I think we hear this across medicine generally too. You can move out of racism to just primary care, right? Like people are saying family docs are really suffering under admin burden, and then nothing ever changes. The amount of paperwork remains at the same height that it always has been, and the
Mhm.
downloading of all of the things that other people in the system don't want to do continues to get downloaded to, family physicians, right? And so I think when you're looking at concrete stuff, um, there will be things that we'll announce with the action plan, but specific things that I've heard from Indigenous stakeholders, like with ITK, Natan Obed, Inuit leader who spoke to us pretty early on as we were going through our stakeholder consultation. He talked about TB. It's 300 times higher in the north.
Mhm.
There still is no good strategy on how to address things. They're millions of dollars short.
Yeah.
We often talk about an investment of, $1 billion to fix primary care in Ontario, but they're just asking for, 40, 50 million to fix it across Nunavut, like all of Nunavut. Right. And so, um, I think it's important to like move to those concrete examples when we go to action.
Mhm.
But
Okay.
just like any problem, there will be places that have more severe problems that we need to address, and then other ones where we know that things are present, but we maybe don't need to intervene immediately. One of the things I always say whenever I'm teaching about racism is racism exists everywhere, but it's not necessarily a problem everywhere at the same time,
Mhm.
right?
Mhm.
And so I think with kind of having abstract and concrete ways of describing things, you know, you can bring people in with abstract things, but to get that action, you got to get specific. And I think that's where the names and the examples and the specific things that you're trying to change come in.
Okay, that's incredibly helpful and also
Mhm.
hopeful because it's being linked to action. It's linked to change, as you said, right?
Mhm.
You talk about that, right? That action is required for reconciliation. We have, so I've been enjoying this. I just want to give space to folks if they want to ask um, questions. Okay, we got a question from Instagram. Okay, so it's coming through a different way. So I'm going to ask a few questions and then we'll wrap up unless you're able to stay
Sure.
a few minutes. Usually when I'm trying to close, that's when all the questions come in, right? Like the patient at the doorknob, doctor, I've got chest pain, like right as they leave. So um, from Devron, I've got, as a Black student interested in medicine, specifically undergrads, do do they engage in decolonization and learning more about Indigenous communities? Um, oh, okay, in medicine, I think, right? Like,
Mhm.
because it's hard for us to say what happens in undergrad. I think you're saying you're in undergrad. You want to know if in medicine there is work around decolonization and learning more about Indigenous communities. Alika, please go ahead.
Mhm.
Alika, see,
Yeah.
there we go. Dr. Lafontaine, let me just do the official because people need to know we're doctors. Okay, Dr. Lafontaine, please go ahead.
Yeah. Yeah, so I'll take that kind of two sides of it. One is as a person applying to medicine and then people actually in medicine. So, um, I think if you're thinking about applying to any of the faculties of medicine, getting to know the patient populations in your area is always a good thing, right? So spending time with Indigenous folks, with other demographics where they may need support or other things. I'm thinking of persons in need of housing or other types of social determinants of health needs. So yeah, going out and doing that's a really great idea. Being involved in decolonization as part of um, your preparation for applying to med school is a really great idea. Now, for medical students who are currently in colleges of medicine, I do definitely see a lot of decolonization work at the student level. And I see that there's a lot more outreach and engagement in training and other things with communities that surround medical schools. So I think that's all really positive. I will say though, for trainees, especially medical students and residents who are listening right now, um, make sure you don't shoulder the burden on your own. It's for folks like myself and other leaders across the country. Will create a foundation for you for when you're graduated and done. The very best thing that you can do for Indigenous communities or your community as you go through medical school and training, become a really, really good doctor. That's what's going to set you apart from other folks in the contribution that they could make. And that will be something you can always build on as you build out your career and your impact.
Yes. And anti-racist practice and decolonization
Yeah.
is considered part of being a good doctor. And Indigenous health is on the exams, the national exams,
Mhm.
as is Black health. So that is part, because sometimes there's a whole thing of what does it mean to be a good doctor? It's
Yeah.
all of those things where you see the humanity in your patient and you know that history and you know the challenges that your patient faces and their communities face. But thank you for that question, Devron. I don't know if there are any other questions going once, twice. So I'll ask you a question right now, uh, uh, Dr. Lafontaine, and then we'll see if there's any more questions before we wrap up. But for actually in general, like for students who are thinking about pursuing medicine or healthcare, right, broadly, because there's so many beautiful careers in healthcare. We happen to have chosen medicine. What is your advice for somebody right now who's thinking about it? They're not really sure, but there's something in their heart, something in their spirit telling them this might be the path for them. What are your thoughts?
I think if you turn on the news, it's a really scary time to hear about people practicing in medicine. Um, like I said earlier on, we go through these cycles with relationships, but I think also systems where, things are working really well and then they don't work well. And then we either repair them or they, break down and we replace them with something else. When publicly funded healthcare first came in, that was because the system that came before it actually broke. We had a charitable nonprofit private system. There was very little public funding, and that just didn't work for people. Like Saskatchewan was going through a crisis where if they didn't do something, everything was going to come unraveled. And
Mm,
so I will tell all the folks who are thinking about medicine right now, there is a future in medicine for you. There is an impact that you can make. It may not look the same as it does today, but that's the wonderful thing about getting into a profession where your role is to heal and join people on their healing journeys. Is there'll always be a role for that, no matter what age or time that we live in.
Yes, no, I love that. There will always be a need for that. And I believe in the future and transformation of healthcare. So what it is now, will be different in the future. And we do want to see different people bringing their perspectives and energy into the field. Um, Oh, okay, Devron. So we still have a few more comments and questions. Table, I was walking and typing. What can I do to engage in decolonization as an undergrad interested in pursuing medicine? I ask because I'm not sure where to start. But I believe, Dr. Lafontaine, you kind of alluded to this. It's really, spending your time working with different communities that are experiencing structural change, and I would say reading. But is there anything else that you would suggest for somebody who wants to embark on a journey of, you could call it decolonization, but better understanding the needs of Indigenous communities with regards to
Yeah,
health?
so specifically, if you're in college right now, go to the Indigenous department in either student services, or go visit the Indigenous department where you can take classes or other things. Those would be good starting points to figure out how you can volunteer or get involved. Um, if you live in a city, go to a friendship center. Those are great places where you can meet and connect with people who are involved in kind of meaningful things. I guess the third thing is to find something that you're passionate about, whether it's blood donation or feeding the homeless or whatever it ends up being, and then try and find Indigenous folks who are involved in those areas. But yeah, I think the path into decolonization is the same for fixing any human problem. You will find other humans who are fixing that problem, and I'm pretty sure that if you go look, you'll definitely find what you're looking for.
Mhm. Yes, thank you for that. I think, so we're going to wrap up. I don't see any more questions, but I don't know if folks really realize how much hard work this type of work is. And I can only imagine that it is fueled by a sense of love and a hope for a better future, love of community, love of people who have experienced harm, past, present, hopefully not future, people who have caused harm,
Mhm.
past and present. It requires a deep and unconditional love and dedication to not just medicine but humanity. This is major and historical and beautiful. So with that, on the one hand, number one, I want to thank you for coming on a Thursday evening when you would have had work and other so many things to do, and in September when you're extremely busy getting prepared for this and the apology. I just wanted to know, Dr. Lafontaine, are there any final words or things that you want people to check out or know the links to, or how to learn more? Please let us know.
Yeah, if you type in Canadian Medical Association apology, there is a placeholder page on YouTube for the live stream. As far as I know, there's no limitation on numbers. So if you want to attend or you want to invite family or friends or colleagues, feel free to share that link. It will come live at the instructions that are on there. Number two, for folks who are interested in getting involved in reconciliation or just system change generally, some advice that I've been giving to students is, we're coming out of a time where we were so frustrated with the system that we walked away from it. It was really common for people to protest through resigning from boards or refusing to talk to leaders or all those other things. That's obviously a part of moving things forward. With social injustice, it is really important to stand up against systems that are unjust. Um, but there is something to be said for sticking around to try and work with the people. And if you can't stick around, try and find someone who can. That way, you can work together. You got to work both sides. And I think in the path to reconciliation that CMA has taken, there's definitely been folks on the side of not engaging, but then there's other folks that have kind of done the grind on the other side, which is making sure to stick around. You need those relationships to circle back and actually create these moments where things change. And just really encourage students that if it's not front of mind to be a part of an organization or a movement over a long period of time, years and years, maybe think about starting that journey. It's gonna definitely pay dividends later on in your career.
Beautiful. Thank you. Some inspirational words from an inspirational human being and a leader. We look forward to tuning in on September 18th. Is it 1 p.m. Eastern time? What's the
1
exact time?
p.m. Eastern time. Yeah.
Yeah,
Or
1
it
p.m.
might be Pacific time. 1
Oh,
p.m.
okay.
Pacific time. Yeah.
Y'all please check the
Yeah.
page before I say the wrong thing. But on September 18th in the afternoon,
Yeah.
let us all take that moment to tune in. And then beyond that, let us be committed to change, reconciliation. But in the meantime, I thank you, Dr. Lafontaine, for joining us. And before we go, I just need to make some announcements. And so next week's guest will be Dr. Bolu Ogunyemi, and we'll be talking about dermatology and accountability. Yes, that skin and that hair. We're going to talk about that. But again, thank you so much to Dr. Lafontaine. Thank you all for watching. Follow us on our social media, sign up for the newsletter, and I'll see you next Tuesday at 7 p.m. Eastern time. And again, just a beautiful thing that Dr. Lafontaine is leading, and congratulations to him, all the communities and everyone who was involved, and the Canadian Medical Association. This is beautiful. This is change. With that, I thank you. Good night.